is Dr. Valerie Callender. I'm a board-certified dermatologist.
I'm Dr. Stephen Franzoy, professor of psychology at Marquette University, where I offer both undergraduate and graduate courses in psychology. About 70% of men and about 90% of women who have thinning hair consider it a problem, affecting their self-confidence, their feelings of depression, and how they view themselves as a social object in the world, a beauty object. Because it's considered by most people to be a male problem, women with thinning hair think that they're alone, that they're the only ones suffering from this. They're embarrassed, they're humiliated in many ways, and they don't talk about it. What hairstylists can do is open up that dialogue, and once they do, they can then search with the client for a solution to the problem.
When patients come to my office and they're concerned about hair thinning, it's an emotional visit. These women are so concerned about how they look, how they feel, and hair thinning can be psychologically devastating to a lot of women, and so they're concerned about it.
What hairstylists need to do is to create a very warm environment, a safe environment where they ask some questions, actively listen to what the client is saying, and then respond and let the client know that they can offer some reassurances on how to improve the fullness of their hair over time. For women especially, this is a situation where they are going to be embarrassed to bring it up themselves, but if the stylist does bring it up, ask them, makes a comment on their hair, that they notice it's thinning, that this is going to be an overture for the client to begin talking about this. A hairstylist who is actively listening, who is responding in an empathic fashion, is going to open up the client to further discussion. And that's a very effective way for clients and hairstylists to begin that conversation, leading to a solution for them.
Some of the most important facts is that with hair thinning, there are several causes. It could be the scalp is unhealthy. It could be that there's increased breakage or more breakage of the hair, as well as shedding. And so it depends on what they're concerned about, and some patients will actually have all three concerns. But to educate them on the health of their hair, just like they have to take care of their skin, they have to take care of their scalp as well as their hair.
I think what a hairstylist should do is ask open-ended questions, not simple yes-no questions, but ask questions where the client begins to talk about their concerns, if they have them. In most of the cases, they will have them. Once the client begins to talk about that, the hairstylist can give their judgment, their evaluation, talk about other people who have come in, because the client most likely thinks that they're the only ones suffering from this, or that they're in a very small minority. But what we know is over half of the people that come in to see hairstylists suffer from thinning hair. So simply doing that sort of opens up a new world for the client, that they're not alone and that they've got somebody here, a physical appearance expert, working with them.
I am partnering with Nioxin mainly because of the science behind the hair care system. And I think it's very important to educate patients.
About 20 years ago, I conducted the first scientific study on the psychology of thinning hair. And that got me interested in this issue. And then Nioxin approached me to talk about this with both hairstylists and to develop a brochure to help them educate their clients about thinning hair issues, and to do it in a way that would help them to sort of bridge the communication gap between their clients and this very sensitive topic.